good afternoon, and welcome to Across the Fence. I'm Jolay Whitney. According to a study by the National Institute of Health in June of 2020, an estimated 17.8% of Americans had medical debt, 13% accruing debt during the year prior, during the pandemic. The median amount was $429, and here in Vermont, the numbers are no less scary or widespread. Currently, an estimated 62,000 Vermonters hold medical debt. That's over 1 in 10, according to the Treasurer's Office. Medical debt is not due to a lack of personal financial responsibility, but a reflection of gaps in the healthcare system. Medical debt not only a financial issue, but a public health problem as well. And last week, Vermont's State Treasurer, Mike Pieciak, announced a medical debt relief program. Treasurer Pieciak joins me today to talk about this proposal and other agenda items for the Treasurer's Office this year. Thank you so much for joining us.
Yeah, well, thank you very much for having me.
And we kind of already talked about it a little bit, but this medical debt relief proposal was outlined last week. Can you tell me about it?
Yeah, so we think this is an exciting proposal, and it fits in line with sort of our philosophy at the Treasurer's Office. Where can we make a big impact without having a big price tag? And this fits right in with that. The proposal would eliminate up to $100 million of medical debt for Vermonters and do so at a cost of $1 million. In terms of the elimination, it would really focus on moderate and low income Vermonters, folks that have older medical debt. So this is debt that's 18 months old, 7 years old, and even though it's older medical debt, it still can be a drag on a person's financial budget, and it can also be something that prevents them from seeking medical care. So it has a big impact if we can eliminate it. On the cost side, it's just a fraction of the $100 million because it is older medical debt. It is held by moderate and low income Vermonters. And we have a plan for that $1 million as well. We'd previously been appropriated some money a few years ago to the Treasurer's Office. We think that money would be better to be reappropriated for this purpose. It would have a bigger impact. So there's no new spending that's required for this proposal. There's not a single penny in taxes or fees. We always also think that's important when we make a proposal, that we have a way to pay for it that doesn't impact Vermonters' pocketbooks. So overall, we think it's a really exciting proposal. It also includes a prohibition on reporting medical debt to a credit rating agency, which would help an individual have a higher credit score, meaning that they paid lower interest on a car or a home or their credit cards. So that also helps their kitchen table issues, their pocketbook as well.
So 100 million and $1 million are pretty different numbers.
Yes.
How are you kind of squaring that difference?
Yeah, so the reason that you can get this sort of really big impact is because of the kind of debt that we're purchasing. Because it would be older medical debt, the likelihood of repayment starts to go down, and the older it is, the less likely it is to actually be repaid and be repaid in full. And then because it's held by moderate and low income individuals, there's also heightened likelihood that it would not be repaid. So when you combine that together, that's where you can get this really dramatic benefit without having a big price tag. The entity that we would partner with is called Undo Medical Debt, and they have a long track record of purchasing medical debt across the country. They've eliminated about $15 billion of medical debt in the United States. And they've been able to achieve that ratio basically with every partner they've worked with in every part of the country that they've worked with. So they have a long track record of doing this, and we want to make sure that Vermonters are able to benefit from this program as well.
So this isn't just medical debt accrued in Vermont, it's debt by Vermonters, is that right?
Yeah, it's debt by Vermonters. One important place, I grew up in southern Vermont, and people sometimes get their health care in New Hampshire. In southern Vermont, particularly with Dartmouth.
Absolutely.
40% of Dartmouth patients are from Vermont. So we've had conversations with Dartmouth, and we'll continue to have conversations with other hospitals that we think might be important outside of the state. But really it's Vermonters. So Vermonters are getting their health care in New Hampshire. If they have to go to Albany, if they had to go to another hospital around Vermont, we'll do our best to try to get those hospitals to participate in this program if it gets passed by the legislature and signed by the governor.
And you already kind of touched on this a little bit, but tell me why it's so important to protect credit scores from getting this information, or protect people from their credit scores having that.
Yeah, well, medical debt's different than other kinds of debt. When you are actively getting a credit card, it's an intentional decision you're making, and then you're deciding to put things on the credit card. If you're trying to finance a car, you're making that intentional decision. If you're getting student loans, similarly, you're making this decision to seek higher ed and to get loans to help you to do that. With medical debt, oftentimes you just find yourself in the middle of a medical emergency. You don't have the ability to say, I don't want to take the ambulance, I don't want to take the health care that you need to provide to me. One, because you might not be in a position to even be able to say yes or no. Another, even if you are in a position to say yes or no, you don't really have a decision. You need the health care, you need to get better. So it's different than any other kind of consumer debt. And you also don't really have the opportunity to sort of say, no, I don't want this ambulance ride because it's too expensive. I'm going to take this other ambulance, like you would in other consumer debt situations where you're shopping around for a better deal or making a decision to forego whatever it is that you're thinking about financing. So it's just different in terms of the way that people accumulate medical debt. In terms of protecting the credit score, that's why it's important, because it's not indicative of somebody's creditworthiness, their ability to pay back that debt. It's something that happens to them. It's something that is very different and unique. So it shouldn't have that impact on the credit score. It's not a good indicator for financial institutions to know whether or not they should lend somebody money for a home or a car. So by eliminating that from the credit score, you have the impact is gone from the credit score in terms of the number, like your actual credit score, but then also in terms of your ability to get credit and the amount that you pay if you do get that credit.
Absolutely. Your credit score shouldn't reflect the worst day of your life.
Yeah, exactly right. Yeah.
Absolutely. And you weren't alone when you announced this. Plenty of other states have programs like this. You announced it with the Rhode Island Treasurer, if I'm right.
Yes.
So is this something you hope kind of expands nationally?
Yeah, for sure. I think it's a really smart program. There are about 7 states now that have a medical debt program similar to this. There's a number of counties and cities that have done so as well. So there are about 20 jurisdictions in total that have a program similar to this. Vermont, if we were successful, would join Connecticut and Rhode Island in New England. Because it has such a large impact and you're able to do it at such a small dollar amount, I think it makes sense to continue to expand this. We'll certainly talk to other treasurers across the country and try to encourage them, based on our experience, if we're successful, to be thinking about this as well. And obviously undue medical debt, prior to partnering with governments, they were doing this on their own philanthropically. So they've had a national program, but it just wasn't focused on a particular state or a particular jurisdiction. And also when the state participates, it can help bring additional resources to pay those debts down more quickly as well.
And you already mentioned you were speaking with Dartmouth when you started this program. So what are healthcare workers or healthcare and providers saying?
Yeah, so far the reception has been really positive. They are in the business to help their patients. They want their patients to be healthy. They want them to be successful. They know that medical debt is sort of a system, as you mentioned at the top of the show, of a failed system, really. It's nothing that is the fault of the provider. They're providing the care at the price that's been negotiated. Folks most times have insurance, but sometimes they don't. But even when they have insurance, they might be underinsured, meaning they have a big deductible or a big copay. So the system just isn't working for everybody, and people find themselves in medical debt. So if they can do something to proactively help their patients, both from a health equity standpoint, so that they can come back and get the care that they need, but also from a financial standpoint, to make them more financially successful, they have so far I've been very encouraged by the conversations that we've had with them.
Sure. How about with insurers? Is it the same reception?
Yeah, the insurers, the program really focuses on the providers. So the providers are the ones that hold the medical debt, and that's where we would be focusing. It's the possibility that an insurer might have similar kind of debt, at least in terms of debt that is required for healthcare, but it wouldn't be the point of care. The point of care is really with the healthcare provider, and those are the entities, the hospitals, a large doctors network. Those are the organizations that we'd be looking to work with, to negotiate with, to actually purchase and eliminate the medical debt.
Great. We're getting towards the end of our show, but I want to pivot quickly and talk a little bit about Vermont Saves, another program you've introduced this year. Tell me about that. Yeah,
Vermont Saves is an exciting program. It's similarly, as our tagline was, it's a program that will have a big impact, not a big price tag. It's a program that will provide retirement to 88,000 working Vermonters. These are Vermonters that work for small businesses, they work for nonprofits, but they don't have retirement. And the data shows that if you don't have retirement through your workplace, you just don't save for retirement. So you have a less financially secure future. You have a retirement that has less dignity. You have a lot of anxiety as you're approaching and in retirement. So what we wanted to do is provide an avenue for people to easily save, to do so through their employer, through automatic payroll contributions, at no cost to the employer, but we wanted the employer to be required to sign up and required to put their employees in the system. The employees can opt out, but all those steps are really important to get participation. We launched it in December, about 6 months ahead of schedule, and it's in open enrollment right now, so through the end of February. We have every day we have more businesses and more individuals coming into the program. We hope that we're seeing thousands of people in the program by the time February hits. And so far, one thing that's encouraging to me is a lot of younger people are in the program, and a lot of younger people are saving, and they have a lot of time on their side in terms of how much that money will grow as it's invested in compounding over the decades. So it's a really good thing to see early on.
And you already touched on this quickly, but who's getting involved with this program? What kind of employers are getting involved?
Yeah, so all employers, you know, one of the things we did, basically if you're an employer that has 5 or more employees and you don't have a retirement plan now, then you'll be required to sign up for Vermont Saves. One of the things we did early on was create an advisory board of all different types of businesses and industries. We had Footbrook Farm on the advisory board. They're a farm in Johnson. We knew that agriculture was going to be an important place for us to focus because a lot of farms are small businesses that, you know, aren't in a position always to afford a 401k or other kind of retirement program. So to be able to provide it to them at no cost was important. They actually were in our pilot project that we had, and they've been very helpful in us to think about how to get this to other businesses in the agricultural sector.
Absolutely, and we're almost out of time, but I really quickly want to ask, it sounds like you already have a lot on your plate, but is there anything else you're really hoping to put forward this session?
Yeah, well, you know, we have some things that we're focusing on for our office that are sort of things that we do every year to update things around pensions or around other programs that we have. One thing that's coming up that we're always excited about is our Unclaimed Property Day, which is on February 1st. So we've been doing a lot of work to try to reunite Vermonters with their money.
Sure, mark your calendars.
Yes, exactly right. So $130 million we still hold. We just did a program right before December called the Money Back Program, where we returned automatically about 5,000 Vermonters received automatically payments from our office totaling over $1 million. So that was something that was different and unique. Usually people have to come to us to get their unclaimed property. This was us automatically sending it back to Vermonters. So we're going to continue to try to find ways to, be innovative and be creative and try to help individuals as best we can. And we look forward to legislative session as well. I think there's a lot of work to do for all of us to roll up our sleeves and get to work.
All right, thank you so much for joining us today.
Yeah, thank you.
And for more information about the Vermont Saves program or the medical debt relief we talked about earlier, you can go to the Vermont State Treasurer's website. The address is on your screen. And I want to thank the crew behind the scenes here at WCAX who are always a good investment. I'm Jolie Whitney. This is Across the Fence. Have a good one.